We're now connected with Dr. Anastasia Fodianto, a general practitioner from MMC Hospital. Good morning, Doc.
Hi, Doc.
Thank you for joining us.
Good morning, everyone.
Morning, Dr. Anastasia. Before we deep dive into what TB is, how prevalent is TB in Indonesia now? Because I know that each country has different numbers. What about in Indonesia?
Up to this moment, tuberculosis in Indonesia is categorized as the second world's most country with tuberculosis patients.
Wow.
Oh, wow. That's a lot.
Big. So now that we're more aware of tuberculosis, what are some of the early symptoms of tuberculosis that we need to be aware of?
Okay, from tuberculosis itself, the symptoms can be categorized into two. The general symptoms that patients may complain are feeling of weakness, no appetite, weight loss, fever, and also night sweats. But the main symptoms that is very a characteristic of tuberculosis are a bad cough that lasts for 2 weeks or longer, chest pain, and also coughing up blood or sputum in severe patients.
Wow.
So it is not always the same for everyone.
Right. There are two kinds of TB that are latent and active. Could you tell us what are the difference between the two kinds of TB?
Okay, from TB active, as it say, it is an active form of tuberculosis. So the patients might complain of cough, night sweats, and fever. So it is an acute form of disease. But in TB latent, the disease is already chronic. So the patient might get infected 1 year or 2 years before, but at this moment there are no symptoms. So it is more like a silent disease.
Oh, wow. So that sounds actually a lot more dangerous when you don't know it's actually there. Now, you mentioned other symptoms other than the main ones, which are coughing. So apart from the lungs, can this affect other organs inside your body as well?
Yes, tuberculosis can be classified into two categories. The first one itself is the tuberculosis in the lung. We call it pulmonary tuberculosis. And the other category is outside the lung. So we call it extrapulmonary tuberculosis. So the organs that can be affected are every organ in our body from head to toe.
Wow.
Right. Doctor, TB is transmitted through droplets when people cough, sneeze, talk, laugh, or even sing. Do you see the number of TB cases dropping in Indonesia during the pandemic? Because, a lot of people on the streets, wherever they are, a lot of Indonesians, they wear masks on a daily basis.
The prevalence itself cannot be said as dropping down because the symptoms are similar with COVID. So it is more likely not found people with tuberculosis because people are more likely to be diagnosed as COVID. So the tuberculosis are less profound, but the number of prevalence cannot be said as dropping down.
Okay.
Well, that sounds a bit concerning to me since COVID is on the forefront of everyone's mind. So what is the general checkup that you would determine whether the diagnosis is, I mean, obviously if you go get yourself tested, you have a cough and it turns out it's not COVID, then perhaps it could be tuberculosis. But what is the actual testing process like in order to find out if you have tuberculosis or not?
Okay, for the testing, the doctor might ask for the symptoms first. Then the next one is the physical examination. We'll hear the lungs. Are there any breath sounds that is not regular from healthy patients? But for the next evaluation that we might check is the sputum check. So we'll give the patient a pot to put or cuff their sputum, and it will be diagnosed in the micro laboratorium to find the germs.
Okay.
Well, is it possible, well, this is actually a double-barrel question. The first one is it possible to eradicate TB in Indonesia entirely? And if not, what are the challenges of eradicating TB in Indonesia?
Okay. For eradicating, it is very hard in Indonesia because the population in Indonesia itself is very populated, very massive. So tuberculosis itself is are transmitted through droplets, and also in Indonesia the houses are very compact, very populated, so it is more higher to be spread.
We've heard that men are more likely to develop tuberculosis. Is there any truth to that? And if so, why?
According to journals, men are higher to be diagnosed with tuberculosis.
Oh, no.
Why? Because men are more active and more productive, so they are at risk to develop diseases, and they may contact more with people, so they are more at risk. And also, men tends to like alcohol and also get HIV. So with these comorbidities, they are more likely to get TBC.
Right. According to WHO, Doc, lack of public knowledge regarding TB symptoms and place to go for examination, diagnosis, and quality guaranteed treatment for patients. This actually would leave TB patients unmedicated. Could you explain what happens to one's body when TB is left unmedicated? What kind of health complications can happen in the long run?
Okay, in TB that is not well treated or not treated, it can complicate it into any kind of other diseases, and it can spread to other organs. And the risk, if the patient is not well treated, it may cause multi-drug resistance. So if we treat the patient with the normal drugs, it won't eradicate the germs. So it needs a higher or other categories of drugs to be given.
What sort of
So it will
organ, I don't know, gangguan, you know, like what is gangguan in English?
Symptoms? No, they're not symptoms.
Yeah, it's like
Damage, I guess.
yeah, what sort of organ damage can happen if the patient is untreated?
If it occurs in the lung, it will destroy the lung, of course. And so it will affect the patient's daily life. It can cause dyspnea, and it can affect just their daily life. But if it affects outside the lung, such as abdomen or spine, it also can disturb the patient's daily living every day.
Right. Doc, so we're not alone here today. We've got our colleague Weeby, who's got several statements, perhaps, that he'd like to fact check with you with a little game of true or false. Weeby, take it away.
The first, in the beginning times of when the disease came in. But, we're familiar with TB. We know it as TBC here in Indonesia. It's been a while, so there are lots of myths that I would like to ask you, Doctor. So we're going to play a game of true or false, and I'm going to ask Marissa and Paul these myths. I'll let them answer it, and then I'll let Doctor dispel if it's really true or not, and explain furthermore about these questions. So, are you guys ready?
Yep.
Okay, first up, tuberculosis is a hereditary disease.
False.
False?
Yeah, I'm gonna go true.
Right. False.
Really?
I don't know. Yeah.
Marissa
Okay.
says false.
False.
How about it, Doc? Is it true?
You know why? Because my instinct is always wrong on these questions. That's why I'm gonna go opposite of everything that I normally
All right.
instinctively would answer.
How about it, Doctor?
Doc?
Of course not.
Okay, go.
Well,
It is not
for the sake of
hereditary.
playing devil's advocate, that's what I
Okay, so I have a second myth, Doc. Marissa and Paul, you ready?
Yeah.
The bacteria that causes tuberculosis can be transmitted through clothes and cutleries.
Interesting. Cutleries, yes, because of the droplet, because Dr. Anastasia said about the droplet.
Right.
Clothes, I'm not so sure, unless you're probably
No.
The cutlery,
Yeah.
if it's not washed and you're sharing the cutlery, yes.
I'd
But if you wash it, no, of course.
Right. We're
I'd
talking
say
about
false.
sharing.
I'm gonna go false.
You
Yeah.
gotta go for
I'm gonna stick with stick to my guns today.
All right, there you go. How about it, doctor? True or false?
Some true, some false.
All right. Can you please
Marissa, you're nailing
elaborate?
it. Okay, obviously the cutleries one is going to be the truth
Yes.
one, right?
Right, right. So,
As long as we get contacted by the sputum
Right.
or the droplets.
but it's interesting, Marissa's question, doctor. If the clothes have been washed, does it still pose a risk of spreading TB?
No.
Right.
Of
Okay.
course not.
Oh, by the way, quick question, Doc. How long do these droplets last when they're on
Inactive.
if they're not on organic objects, like if they're just on if it's on a table, how long do these droplets? Can you catch tuberculosis off these droplets? Do we have an idea?
Maybe less than an hour because it is a bacteria, so it doesn't last long.
Right.
Like virus.
Okay.
All right.
No.
Okay, I have my next myth, guys. Tuberculosis patients must be isolated. Marissa.
Ooh. Maybe wearing a mask is good. Yeah, I think it's best to be isolated.
Right.
Because if the transmission is through droplets, and it is transmitted through sneezing and coughing, and if you don't cover yourself,
Uh-huh.
so yeah, it can be transmitted.
So it's a yes from you?
Yes.
Paul?
I'm gonna say false.
You say a false.
Yeah,
Okay.
I'm gonna say false.
It would be great to be isolated, but not like COVID isolation, just 14
Yeah, that's what
days.
I'm imagining. I'm like, oh no.
No.
Yeah.
Don't isolate the person.
How about it, doctor? True or false?
It's false because
Ah.
they can do their daily activities, but they must use mask or while coughing they must use tissue or
Right.
their elbow and wash their hand thoroughly.
Yeah. So
There you
it's
go.
a bit
Right.
like COVID protocol as
Yes,
well.
I got one.
That's the COVID protocol, not further than that. All right, but that's all the myths I have for now. Back to you, Marissa and Paul.
Thank you, Wibby. Dr. Anastasia, I have a question because tuberculosis is treatable, right? So what sort of treatment that TB patients need to have, and how long does it take for them to recover from it?
Yes, TB is treatable and curable, but it takes several months, up to 6 to 12 months to take the drugs.
Right.
So the drugs itself are in a pill combination and injection. So as long as they taking it as prescribed, it should be eradicated by the end of the month.
Doc, can you tell us a little bit about TB ROG or ROG?
Yeah.
It's known to be drug resistant. In fact, around 52,000 TB ROG patients underwent therapy and only 47 of the patients were able to recover. So what would be the approach if somebody has this particular form of TB?
Okay. In Indonesia itself, multi-drug resistant is very prevalent because most patients are not patuh
very
in
disciplined
taking
about
drugs regularly.
Right.
Yes, so it is very possible and very at risk to develop multi-drug resistant. How can we eradicate the germs in patients with multi-drug? We have several options for this kind of patient. This patient is regularly injected with the drug, no more pills. So it is more a higher drug combination.
I see. How long does it usually take for them to recover if they experience TB ROG?
For multi-drug resistant, it takes up to 12 months.
Wow.
Or
a
even
year.
up to 2 years.
Oh my God.
Long time.
How do we avoid getting TB, Doc? How do we do that?
How do we avoid? Of course, use masks at this kind of pandemic time, and also while coughing, cover your mouth with tissue, or if you don't have tissue, use your elbow.
Yeah.
And don't forget to wash the hands.
You know, Doc, I would like to confirm one method. Since the pandemic, whenever I sneeze, I always do this. So I put the droplets in my clothes, under my shirt. Is that okay, Doc?
No, because you're taking it back home.
All right.
And it would make that myth from we be true then. You can get it from your clothes.
You're
and keep
right.
coughing inside your shirt.
Oh my God, because I want to protect everyone because, you know, it's like doing this, I know that it's advised to
Right.
do this right, but I always feel a little bit insecure. You know, the droplets might go up or
bounce
go
off
down,
your
right?
elbow or your
Yeah, if it's like this, it goes to my stomach and it's okay, I'll have a shower later.
That's true. It's a good point. If you have nowhere else to be but to go home, right? Anyway, Doc, thank you so much for your time and for giving us a little bit more of a deep dive into tuberculosis on this special World Tuberculosis Day. We hope that you stay healthy and safe, and hope to talk to you again really soon.
Thanks,
Have an awesome
Dr.
day.
Anastasia. Bye.
Take care.